Hello, hello. It's me, Dr. Catherine Toomer, just making sure my phone is off. Don't want it ringing in the middle of my talk. Well, it's me, Dr. Catherine Toomer, and welcome to Dr. Toomer Talks on Tuesday. And you got me to yourself again this week. So I wanted to say thank you for those of you who join in, say hello, and for anyone who listens later, put in hashtag replay. I apologize for last week for some confusion because I was not here and was not in, I was actually stuck in an airport and so unable to get into Wi-Fi in order to let everyone know that what was going on. So today I want to talk about weight health medications and but mostly about weight treatment. And I'm going to say hi to Chris. Thank you. Sorry about last week. I wasn't here. So I want to talk about weight loss medication. First of all, weight loss medications is a misnomer. There really is no such thing as a weight loss medication. What medications do when it comes to weight health is that they help treat the reasons for weight gain. Weight is simply a symptom. It is not the cause. It can cause other things once, it's out of control or once it's happened. You might have secondary joint issues or some inflammatory issues. Um, Adipose or fat in and of itself puts off its own hormones, its own endocrine system. And so, of course, secondarily, there can be some things. And that's one of the reasons why we even care about weight. It has nothing to do with the number on the scale, has nothing to do with the appearance, it has nothing to do with anything other than if it causes some health problems. If there's no health problems and all numbers and all parameters and all health parameters are normal, weight is not a problem and therefore is no need to treat it. However, there may be causes for the weight gain, and that is important. And anytime the human body does anything, there's a biopsychosocial reason. So we have to look for the biology, understand the psychology, and look for any social ramifications of the way things are. And so when it comes to weight, often there is an underlying hormonal issue and there are lots of different reasons why those hormonal issues happen. Often, for many of us, it's stress. It's stress pushing us into insulin resistance because our cortisol levels are high. And when cortisol levels are high from stress, what it does is it makes the pancreas push out insulin. It causes our body to become less sensitive to that insulin. And so any carbohydrates that we eat don't get into the cells to produce energy, and instead they get shifted to making fat. And our body gets really efficient at doing that when under stress. And so when that happens, the body grows, fat cells grow, weight goes up. But it's not the weight itself. The weight is simply an indication that there's some underlying stress and hormonal reaction. Just like when our weight goes up because of taking steroids for medication, or we may have some thyroid issues. Thyroid's not working properly, and therefore when you have a low functioning thyroid, your metabolism drops. And when your metabolism drops, what that means is your body becomes less efficient at burning calories. It becomes less efficient at making energy out of the food you eat. And so, again, weight goes up. But again, weight is a symptom of something else. And we always should look for that something else. So, when we talk about treating weight, what we're simply talking about is treating the underlying cause of weight gain. And as long as blood pressure parameters are normal, as long as hormonal levels are intact, as long as there's no other underlying reason for someone to be BMI to be maybe higher than what is considered normal, like our bodies read textbooks anyway. So they don't know what's normal, what's not, but our body can be functioning quite well no matter what our weight. And so when that's the case, there's no reason to treat. There's no reason to do anything. Now, There are psychosocial reasons that this can happen. I already mentioned stress. It does cause some secondary psychological issues, but so does depression. Depression changes what our body does with food. It changes our behavior around food. It changes what we seek out to eat. Same with anxiety and other psychological conditions that change because of control or because of cravings or because of what effect it has on appetite. But again, when weight is affected, it's caused by something else. So it's really important to understand if there's some underlying issue with psychology, not weight. We're not treating weight. Again, you're treating the underlying cause and any of the issues that those um, diagnoses then present or how they present. And then there's always the social. Now, that seems to be the biggest issue. That's where we see a lot of discrimination. We see a lot of bias. We see a lot of meanness. Really, in our society, fat phobia, being mean to people who are overweight, laughing at people who are overweight, making people who are overweight the butt of your disparaging jokes or disparaging comments are the last place where it is socially acceptable to do that. In no other area is it acceptable to laugh at someone because of their physical condition or to insult someone because of their physical condition or the way that they look. In Western society, yes, thinness is a currency. And when you are thin, you have privilege. And anyone who tells you that's not true has never been thin or has never been overweight and has felt the difference. I can tell you, having been in both situations, yes, there is a distinct difference in how you're treated based on your body size. That shouldn't be the case. But again, that's a social issue. That's not a medical issue. That is not a biological issue. That's not a psychological issue. That is a societal issue. And when society then pushes negativity onto people and that gets internalized, it does again then create a stressful situation, which then snowballs and then connects and becomes a weight issue or worsens a weight issue. So again, medications for weight health are simply to treat the causes of weight gain. Now, of course, there are some medications which suppress appetite and that have people will eat less and they might drop some weight, but that only happens in people who overeat, which isn't most of us. Most of us who've been overweight and who are overweight do not overeat. We may not eat the food that's right for our body, but it's not because we eat too much of it. So if you have hormonal issues, of course, carbohydrates then are not our friend. And I know this for me, and I know this for a lot of other people. And so that's why managing carbohydrates tends to work so well. So if you are in a situation where you're perfectly doing all the pillars of health, drinking enough water, eating enough protein and calories, getting enough sleep, managing your stress levels, moving every single day, and you still notice that your body is not changing in the way or feeling in the way that you feel is healthy, or you may not, or your weight tends to does not reflect those behaviors, then it's really important to look for any underlying causes. It's important to screen for depression, for anxiety, for ADHD. It's important to screen for thyroid issues, screen for insulin resistance or prediabetes or diabetes. And the way to do that is not with fasting labs. The way to do that is with glucose tolerance tests. When you do a glucose tolerance test and you check insulin levels along with the glucose, that is where insulin resistance will reveal itself. And when that happens, you can then treat the glucose dysregulation to prevent further weight gain and prevent your body pushing you closer to diabetes or prediabetes. So again, treatment is really important, but not for weight loss. There is no treatment for weight loss. It's simply treating the reasons for weight gain. And there's a very important distinction. And it will also help in preventing the shaming that's going on with people who are taking control of their health, who are using medications that facilitate weight gain because they're treating the underlying cause of, I mean, who are treating their weight gain and then having weight loss as a result. But again, it's because of an underlying condition. And so, again, the pillars of weight loss, or the pillars of weight health, I should say, because weight loss is relative. It's a number on a scale. Everybody's, weight's going to be different. You can have someone who's very, very thin, who's very unhealthy, who has a fatty liver or who has other issues. And then you can have someone who on a BMI is a little bit higher than what is considered textbook normal. Again, our bodies do not read textbooks. We just know what feels right, and it just goes to where it goes. And so, just because someone's BMI does not fit within what is considered normal medically, does not mean that they're unhealthy. Most people who are very muscular do not or have higher than normal BMIs. So, and of course, we know that if someone's body fat is too low, they could actually not be healthy, but they may be considered thin. So again, size doesn't matter, weight doesn't matter. What matters is your health. And so the best way to make sure that your health is good is to move every day. Make sure you maintain your muscle mass, make sure you maintain your protein intake and calories, drink water, sleep more, and reduce your stress. So again, I'm Dr. Catherine Toomer. I'm a family medicine and community health physician. I'm the founder of Total Weight Care Institute, and I help patients maximize their health and wellness through their weight health and through maximizing their health through making sure the underlying reasons of their weight gain are being addressed. And then I also teach physicians or any clinician who wants to learn how to provide comprehensive and compassionate weight health to their patients, because the shaming has to stop, the stigma has to stop. There's a lot of reasons to help people get their underlying causes under control that have nothing to do with the number on a scale. And so if you want to contact me, you can. You can contact me here through Facebook and through Messenger, or you can contact me on my website, which is drtoomer.com. That's drtoomer.com, and send me a message. I watch for the messages. My assistant watches the messages. And if you just have a question, or if you have, you're not even sure if there's something going on, or you suspect something might be wrong, I'm one of those doctors who believes that I just don't feel right is a symptom. It's real, and it should be looked into. So again, thank you for joining, and I'll see you again next Tuesday at Dr. Toomer Talks. And if you have questions, you can put them in the comments, and I will answer them as best I can, especially after this video, so that all the comments that come through. And I just want to say thank you, Chris, for always supporting me. And there's Dr. Foster. Hello, Lorna. How are you? And Dalasai. And Bradley, thank you for showing up. So thank you. And I will see you again next week at Dr. Toomer Talks on Tuesday. Good night.